Good to see you all. So let's go through some data and just a couple updates, and then we'll take questions. Nice day. No new deaths to report. We've lost 709 of our residents since March 16th of 2020, but certainly always nice to start out there. 7-day average is actually coming down, about 1.2% now. The positive rate is a metric now that we're not following as intently as we once did, because the test pool of the community is very targeted. You're either sick, obviously if you're sick with COVID symptoms and you're getting a test, you have a higher probability of having COVID. Or you work in a place of business consistently that still requires you to get tested. So your overall randomness of your sample is not as valuable. So we'll continue to track it. It's gone down the last few days because we've had very low case days, but it's not like other parts of the state. In higher density areas, if you're in New York City, you have medical workers getting tested almost every day. There's tens of thousands of them. That's going to help drive your numbers down. So this isn't really the best metric. The best metric is our active cases. We have now had 37,796 positive cases since, confirmed positive cases, since March 16th of 2020. That's 10 new cases. It's the lowest number we've had in probably 2021. I know it is, but an extended period of time. Our active case number is down to 175, which is fantastic, and so very happy there. Our hospital number is down. We're down to 23 of our residents in the hospital, with 6 residents in the ICU. Certainly we're thinking about all of them and need them to get well so they can get home. Vaccine distribution is now going to focus solely on finishing up second shots and in our zip codes that are underperforming. And so this Saturday, in partnership with Kinney Drugs, there's going to be a clinic at Berry Park as part of the Let Me Be Great No. 44 Festival. I want to thank Rashida Caldwell for her help with this. The various zip codes in the city are still lagging. We're working with the mayor and his team to continue to address and provide access, but they're getting better. We're making small improvements. Next week, we're also doing our second dose clinics in schools for our 12 to 15-year-olds. We'll probably get some first doses out of that too. And then moving forward, we're going to strategically work with the mayor and his team on some other pop-up locations throughout the city. But moving forward, on June 22nd, we'll have weekly vaccine clinics here at the Civic Center on Tuesdays in the basement, not the On Center, the Civic Center, where my offices are, on Tuesday in the basement. And we will, obviously, our buildings are open. There's many people interacting in our buildings with our departments. We will encourage participation in the vaccine when people come in to our departments for services as well. So we're going to really focus in on that in our efforts on getting these percentages up in these zip codes, or at least making sure that it's accessible, right? We understand some people won't get it. 62% of county residents have received the first vaccine dose. That's a really good number when you consider there's at least 85,000 residents, children, that are not eligible yet. Over 72% of 18-year-olds and above have received their first dose. These numbers are what's driving our caseloads now. Between these vaccination numbers and then certainly the natural immunity that exists here as well from positive cases, we're getting very close to that herd immunity, and hopefully that will continue. Our lowest zip code from a percentage standpoint is still 13204. That's at 33.2%. Our highest zip code is at 68.1%. That's 13066. That's Fayetteville. The other city zip codes, which is where our focus will be, Remember, we were in our 20s and 30% range. Now we're in the 30s, and almost all of them are getting towards the 40% and some in the 50% range. Town of Salina 13211 still at 46.3. Bridgeport 13030 still at 47.3. Fabius at 49.6, so we're probably a handful of vaccinations away from getting over 50% there. Skinny Atlas Falls, the rural part of the Skinny Atlas community, 13153, is at 45.5. So still some rural communities and some of our urban communities still not quite at that 50% number. So we'll continue to keep offering the vaccine till we get there, until we get everybody who wants a shot has the opportunity to get a shot. Looking at age demographics, 12 to 15 years old, 27.1% of the residents in our community have received the shot. 16 to 19, we have 41.7% of the residents have received the first shot. 20 to 29, 49%. 30 to 39, 55%. 40 to 49, 58.9%. 50 to 59, 65.5. 60 to 69, 82.8. That's a great number. This is the best number, though. 70 to 79, 94.3%. And then 80 plus, 79.3%. So the 62% in total. Completed series, 51.6% for all the demographics. Obviously, we got room to grow in our younger populations, specifically 12 to 15, and 16 to 19. And so we'll continue to work and get parents comfortable. Keeping it local, Monday, June 7th. That would be this Monday. Big day, 7 p.m. The site will open up for people to get vouchers for the local restaurants. Remember, we're going to have 0.25% of the those vouchers held off for seniors to call into a senior line as well. But that website, again, ongoved.com/keepingitlocal. We're going to continue to support the industry that has been beaten up by this. So we'll get through this process. We'll then look at a second phase, and we got a couple other creative things we're going to do to help support our arts community as well that we can talk about maybe later next week. But overall, just to give my assessment, you know, we've done a great job. Again, I want to thank all of the, as a community, want to thank all of our partners that have been vaccinating. The reason why these economic restrictions are starting to go away, the reason why we see light, and it's bright light now at the end of the tunnel, is because of those efforts, and certainly members of the community that have taken this pandemic seriously. Really remarkable teamwork that's happened over the last 16 months. Happy to take questions on this or anything else.
Are you planning any pop-up clinics in some of the rural areas like Skinny Atlas Falls?
We've done one there. We'll probably, I want to see a little bit more data to understand if maybe there's a better spot to do it. We did it at Hillrom, which is right in Skinny Atlas Falls. But yeah, so we're going to, we have access to the vaccine, right? And so I think at this point what we're seeing is the immunity is kicking into the community. But that doesn't mean, like the other day, for example, we had 13 cases, 6 of them were travel related, right? So we're going to get to, hopefully we're going to get to where we were in the summer last year a little better, where we just had a handful of cases. Maybe we can get to 0. But there's still levels of risk, right, especially with travel, and that's going to be a part of our economy coming back. So we need to continue to vaccinate and make sure that there's access. Demand at some point will dry up, but access and distribution points are something that we're going to need to continue to do in all these areas. We're going to focus in on the city. We're going to focus in on a couple rural areas, but mainly the city right now, because that's where the most room for growth is. But from that point on, we'll still do it. We'll do it every Tuesday in the Civic Center. Civic Center. And then we will continue to do pop-ups. And at some point, we're going to be looking at booster shots, right? So I have a feeling we're going to be vaccinating for most of my first term as county executive. So.
Have you looked at the number of infections in some of those city zip codes that are low on the vaccine numbers, and compared those to by zip code to some of the better performing zip codes? Is there a
Correlation.
Yeah.
Yeah, it looks like early signs are it looks like there is. So out of our new cases, it looks like there's a higher proportion coming from the city than some of the other outlying. We haven't looked specifically at Fayetteville or Manlius specifically. Actually, hold on, Tim. This is tough because let me get big community. Yeah. So it's part of the challenge in this data. I can't tell you because it factors in loss of life into these numbers, my recovered cases. So the difference, we could have lost. So we'll do it. We're doing a dive into that. But early signs are it looks like the communities that are vaccinated at higher rates right now are seeing less new cases than those zip codes that are vaccinated at lower rates.
Ryan, is the county vaccine incentive program still going on, and also has the data showed that the incentive program has been working and successful in getting people vaccinated?
Yeah, I'm waiting to see what the final number of booklets that we gave out was. It's not going on anymore. We had a targeted period of time. I think it was effective. How effective? Probably hard to quantify, right? How many people would have gotten it anyways? Certainly some people got it and received it because of that, but again, we may have to get creative again and continue to do that. You know, from the age demos, right, there's still room to grow in those younger demographics. You know, you got your 20 to 29 number is, what was it, almost 50, 49, right? I mean, there's no reason why that can't get over 60. So there's still room to grow in some of those areas where some of these vaccine incentives might play better. But it's getting tougher. It's you know, we're you're trying and it's less productive every time we do something. But this is our job. This is like I've said, this is probably the most meaningful thing we'll do while I'm here, and probably one can argue the most meaningful thing any administration's ever had to do. So we'll continue to grind this thing out.
In regards to the 12 to 15 age range, we're obviously above the state average, but we're still a little bit lower than some. Are you content with that average, or are you striving for greater?
Yeah, we can do better, and so I think part of this is, kind of a lot of parents wait and see approach, right? And so I think as time goes by, as next week we do second shots, right? Once these second shots go by and time goes by, and we'll be in a position where they'll be fully vaccinated 12 and 15-year-olds, and they're doing fine, and they're going to practice and doing fine. I think that will help trigger more participation as well, and it gives people more time to talk to their doctors, right? I have 3 children. You don't like taking your kids to the doctor. You take them for regular checkups if you're lucky, more time that goes on where people can have those conversations with their doctors. I think you'll see more participation there, but certainly 27%, I believe, was the number. Yep, we can do a lot better, and we will. I think we will.
In what ways would you say the county is striving to make that number higher?
Yeah, well, we led the charge to get us to the 27, right? And that's usually your first wave is like the true demand. And so now it's about credible messengers, and it's a little bit more personal, right? So these are your kids. We have many parents who've gotten the shot, they've gotten vaccinated, but they're not comfortable with their kids yet. So that's a more personal approach where we really need the medical community to take the lead on messaging there, and they will. And we talk to the pediatricians throughout the community. So I think, again, once we get through second doses, for those who are concerned about various risks, there will be many, many children, thousands of children that have had second doses and are perfectly fine. And then I think that will start to trigger better numbers. But we always knew we're going to get better participation from your 60 years old and above, who are most likely to have the worst outcome with this virus, than 12 to 15-year-olds who, knock on wood, we've not lost a 12 or 15-year-old to this pandemic in Onondaga County.
When you start vaccinating at the Civic Center, will that be all day long, or is that a...
Yeah, we'll do it all day, and it's easier for us from an infrastructure standpoint. We have our teams right there on that floor, so we can do that. And again, we have lots of people coming through that building that receive services, and certainly we think there'll be opportunity there to be credible messengers when they're communicating with us, and then make it easy, right? Come on, we'll just take you down, we'll show you how to do this. So at this point, it's just doing anything we can to get shots in arms.
When you have the restaurant vouchers next week, what's the value that's available?
It's about $100,000 total. Yeah, a little over.
So 25 will be...
Correct. Correct.
Is there a reason why some areas are just not getting the vaccine over other areas? Because you take a place like 13204, it's very different than Skaneateles Falls, but
Yeah.
they're both at those low rates.
Yeah, so when you look at it, I'll speculate, right? But some of it is ideological. Some of it is truly access, although some of it is real hesitancy from history in this country. So when you put it all together, you need to just keep going and keep trying and trying and trying and make it easy. Certainly in the zip codes that are underperforming in the city, we've had multiple pop-up clinics in each of them, right? And so it's not about effort. We probably have done more pop-up clinics than any other county. And it won't be about effort moving forward. I think it's just a harder thing, right? You have things that happen during the process. I spoke to some faith-based leaders today, and one of the things that was brought up was the Johnson & Johnson shot, right? So you look back at it as an effort to vaccinate. Did we collectively, as leaders throughout the country, make a mistake after 8 out of 7 million people having a reaction to the J&J shot to put it on pause? Based off some feedback I'm receiving, I think we probably did. These are all the things that, when you go through this process, nobody ever has. Various factors lead to hesitancy. You just got to keep trying and grinding it out, and that's where we are.
Do you have any updates on policies for seating and ticketing for amphitheater tickets in terms of vaccinations and masks?
Yeah, so we don't. There will be changes this season at the amphitheater. There will be a season, and hopefully it will be, I think the season's slowly growing, which will be good. But Live Nation, so it's a county-owned facility, but part of our contract with Live Nation allows them to set policies at their events, right? So Live Nation corporate is going to drive a lot of the changes there. We obviously will be looking for best practices when it comes to the safety of the public as well. So we'll work with them, but hopefully we'll have that squared away in the next few weeks here, as I believe our first show is mid-July. And we're excited about that.
In terms of the overall economy and business life, does it seem like it's gotten back to normal quickly enough?
No, I still think, when I walk around downtown, there's still buildings that I know companies are still hesitant right now, and I think we got to get through that. It's tough, right? People have been scared. People are still, think about when you're walking into a building now, you're vaccinated, do you feel a little guilty wearing a mask going into the grocery store? These are all real emotions. I had one in my hand yesterday going into Wegmans, just in case somebody yelled at me. But I'm pretty sure they know I got vaccinated. So these are all this is the anxiety. And one of the things that we all have to deal with, myself included, is the goal here is to end the pandemic. And that's going to mean most likely something that's dominated our lives in various ways is going to be over, and we're all going to have to come to some level of closure with that. Some people will be very easy because they never really bought into it. Others, it's going to be a little bit harder. And I think that's kind of where we are on the spectrum. We're closer to ending this now, and so people are going to have to, it's okay. It's okay to get back together again. We're at a great place with this. We're gonna finish strong. We're gonna sprint through the finish line, but we got to get back together again. We got to get the economy going again. We need businesses downtown supporting our restaurants, and we need people ready to go to our arts and cultural organizations and live life. And if we, I think there is some pent-up demand, but I think it's really going to hit. The economy is really going to recover strong, hopefully in the second half of this year when people start doing that. But we're seeing growth, right? Our sales tax receipts are up, but when you compare them year over year from last year, they're up a big percentage. But last year at this time, everything was falling apart. That third quarter and fourth quarter of sales tax receipts for us will really show where we are as far as an economic recovery.
I want to just briefly talk about youth violence.
Mm-hmm.
It was not too long ago, there were two high-profile murders that happened involving young people, and one of the things that came out of a press conference was that there was a 16-year-old female suspect, and there was not room at Hillbrook.
Mm-hmm.
She had to go to Erie County. Do you think that youth violence is a problem in the county, and there's not a place to put some of these people?
We don't have female accused young offenders at Hillbrook anyways. So it wouldn't matter if they're jaywalking. They're not going to Hillbrook right now. We have an expansion at Hillbrook right now via the Raise the Age law that was passed by New York State. Here's a challenge. You have a couple issues. You brought up two of them, right? You asked about violence, but you asked about where do these kids go? When the Raise the Age law was passed, which basically kept your younger population out of adult facilities, one of the things that wasn't considered was that you would have a shift in the violent crime and that it would get younger. In Hillbrook, with males, accused males, we have many, many males accused of murder. This was never a facility that, when you were growing up or I were growing up, housed people accused of that level of crime. Very complicated things. And we don't have correction officers there. So that's a complicated issue after the crime. We have part of that process, there's a theory that because of some of the laws that when you talk about kind of more organized violence within gangs, that younger gang members are being encouraged to commit the violent act for a reason because their sentencing is less. That's a theory, right? There's probably some data to support that, but not completely. But we do have a problem. It's heartbreaking, the ages we're seeing. And as a community, we need to continue to work together to do everything we can to address it. I've talked about for months, there's going to be post-pandemic challenges and victims that we haven't seen or thought of because of what we just lived through. That wasn't the virus. This is one of them. Mental health is one of them. Mental health has a lot to do with some of this. So we're going to be struggling with these types of impacts of COVID and of everything that's gone on in society for a period of time. I think what's good about our community is we have stakeholders and partners at every level that are working together to try to address it, understanding there's not a short-term fix.
And the Hillbrook, that's being expanded. Do you know when that's going to be completed?
Soon. It will be soon. Right now there is a true problem statewide for young violent offenders, accused violent offenders, statewide. We run into issues where we're an incident away from not being able to house people. And so we will be pushing some thoughts to the state legislature about modifying certain parts of this rule. Whether or not it gets legs or not, next session we'll see. But certainly, most days we have our facility full, and we receive mails from all over the state that come in, and so the new wing will help. It will be a nice facility. I toured it the other day, but it's not going to, unfortunately, if there's still demand for it, that's going to be a challenge that we have to work on besides that. But also, when you have 17-year-olds accused of murder, and these are, are they better suited to be in this facility or another facility? That's part of what we need to really look at as a state.
Is there going to be a place for females?
It depends. If the demand continues to be just for males, and we're kind of the male, we're taking in males from everywhere, and females go somewhere else, then that's what will happen. It depends. We are in uncharted territory as a state with this right now, being able to, because you can't take the 16-year-old who's accused of a violent act and put him into your county corrections facility. You can't do that. So you have to find facilities. You really only have regional facilities right now. We're one of them. So we'll have more capacity, but that capacity will be probably utilized from other counties as well. So this is a challenge.
Hey, Ron, can you provide any update on the White Pine proposed Commerce Park?
Yeah, it's great. Again, we're in communication with multiple companies, and the reality is one of probably 3 or 4 sites in the country, in North America probably, that's large enough, that has the wastewater, water capacity, and what makes it very unique is the electric and gas capacity there with the substation across the street. That's why the companies are looking, is because of all that I just referenced. I would like to think it's because they think I'm a pretty cool guy. It's not. It's because of the infrastructure that we have and the workforce that we have and where we're located centrally. So because of all those factors, we are receiving a tremendous amount of interest, and we will continue to in the near future. But I'll leave it at that.
Not naming any names at this point?
No. When you get into this level of discussions with these companies, you're under non-disclosure agreements. And certainly, there's a lot of factors right now. Right now, one of the big factors, what will drive the semiconductor industry, is the pending legislation that Senator Schumer has, which will be taken up in about a week. And then once that passes, that will create incentives for domestic semiconductor manufacturing. Once it goes to the House and passes, I'm presuming it will pass the House. It should. Then you'll see, I believe, any company that had plans to do something will then expedite their plans, and they will have to get agreements with locations. And again, we are one of the top 3 or 4 locations in the country.
And that parcel, where does it stand right now? Is it all currently county owned, or are there still
Nope.
private homeowners?
No, there's still some private homeowners we're hoping to get sales and purchase agreements with. We've gotten sales and purchase agreements with most. Mm-hmm. Yep. And some of it, some of it's they aren't interested in selling at this time. Some of it is they're asking for a very large number. So, those are part of the negotiations. But certainly, with the type of opportunity that we're talking about, it's important that we come to agreements with those homeowners.
Are there eminent domain options available to the county?
The county does have that option.
Brian, did you resolve the question of whether the county is going to pay Skyline the back rent that it would help?
I'm being told it is resolved. We have to pay it? All right, okay. We do have to pay it. Yeah.
There was more withheld than 3, though, right?
I thought so. We can get you the numbers.
But
Correct.
to pay?
Correct.
State, what, law?
Our law department told us we had to pay. Other questions?
Can we get a list of the zip codes that are the lowest performing?
We can give you the complete list. See Justin about that. Other questions?